as a Black nurse, we don't get the same opportunities. And when we do get certain positions or get into certain specialties, we have to work 10 times harder than anyone else to even get in them.
We did a study and we found that National Nursing Workforce Study showing only 7% of registered nurses in U.S. identify as Black. What are the biggest barriers Black nurses face in the profession, and how can we work to increase representation?
I wholeheartedly say equal opportunity is the biggest barrier. When it comes to increasing representation,
Hello, everyone. Welcome once again to Medical Success Secrets, and I'm super excited today. If you don't know, I'm Theo Harvey, owner of SensorMed, and just super excited about sharing you the new normal of healthcare with amazing interviews from providers across the country. Today, I have Nurse Tauqilla Manning, who will go into detail about her journey. How are you doing today, Tequila?
I am doing very well. I appreciate you asking, and I appreciate you having me on your podcast.
That's wonderful. If you don't know about Tequila, she is designing services and foundation of integrity. She is focused on her journey of building a great world-class organization called Black Nurses. And she is really focused on creating an extensive 19 plus year of nursing with a background that includes traveling and interim leadership assignments, and enjoys everyone delivering top quality patient support, team unification, and nurse diversity awareness to help accentuate the entire healthcare industry experience. Tequila has built a strong inventory experiences that have led her to present leadership standing as a nurse. Initially starting her journey as a CNA, Tequila earned her LPN diploma from Panola College in Carthage, Texas, an associate's degree in nursing from Tyler Junior College, and a bachelor's degree in nursing from the University of Texas, Arlington. Since then, Tequila has not only become a RN in several states with her reputation for mentoring future nurse leaders, but also gained several C-level positions within the healthcare field over the last 20 years or so. One of the things that she's really proud of is her role as a founder and CEO of the Black Nurses Week movement, which is built to deliver Black nursing community the honorable awareness and recognition they deserve. In addition, Tequila long-standing dedications have not gone unnoticed as she has gained several illustrious recognitions thus far, the most memorable of all, including being recognized as a powerhouse for her service in the COVID pandemic and earning the Excellence Award presented by the Maryland Army National Guard for her statewide accomplishments. Tequila, wow, this is great and wonderful. When we kind of look at your background and just building out such a world-class organization, really talking to nurses across the country, one of the things that comes up is, building out an organization focused on, Black nurses. We did a study and we found that National Nursing Workforce Study showing only 7.2% of registered nurses in U.S. identify as Black. What are the biggest barriers Black nurses face in the profession, and how can we work to increase representation?
That's a very good question. I think the biggest barrier that Black nurses are facing in the nursing profession is equal opportunity. I think that is the biggest. As a Black nurse, we don't get the same opportunities, and when we do, get certain positions or get into certain specialties, we have to work 10 times harder than anyone else to even get in them. So I wholeheartedly say equal opportunity is the biggest barrier. When it comes to increasing representation, just having someone that looks like you in leadership, or having someone, that can mentor you that looks like you. It's very difficult to have a mentor that doesn't understand the barriers and the things that we go through as Black nurses. So just having the diversity in the workplace, diversity in leadership, those are some of the things that could help, bring more Black nurses into the profession, help Black nurses, advance their career in the profession. It's just really having, those that look like you in the representation, in leadership, in certain specialties and things like that. That's definitely a big help.
That's wonderful. Well, we're kind of in a different world now where people are thinking about representation and what that means, and maybe downplaying what representation means, right, in the workforce and across, even in government positions. Why do you think it's so important for Black nurses to be singled out and helping them, guide them in this pathway toward, their journeys in the workforce?
Well, the same reason they're singled out when they face, the barriers in the workplace. You know, we don't get treated the same. And it doesn't matter who says it's not true, we do not get treated the same. And so it's very important to, as you say, single us out. So focusing on us, because when it's negative, the focus is on us. But if we want to do better and improve, then we have to focus where the negativity is directed. So I feel like when you single out, Black nurses and put forth initiatives to help them succeed and have mentorship and advance, it's because we've always been treated so poorly. And it goes back into, historical days and things like that. But even though racism, it still exists, it was back, in history, it's still alive and well. And so it's just like we're fighting an upstream battle. So yeah, it's important to single us out because you know what? We're great at what we do and we want the recognition for what we do. So yeah, single us out. We'll take that.
I love that, where with pride and understanding the importance of that. I mean, you hit the nail on the head about singling out individuals, but also I think, we see diversity in healthcare is so important because disparities, continue to persist, right? And so having individuals who look like the patients they serve is so vitally important. We experience that in how we deliver our services by having LPNs and RNs who speak the same language as our patients, right? Who have the same cultural backgrounds as our patients. Then the patients are able to open up more and have better conversations with our nurses remotely in telehealth settings. So kind of talk a little bit about that, when you guys look at disparities and how, Black nurses can help combat that. What are some of the things that you feel is important for patients to realize about having a nurse that looks like them from the same background? How important do you think that is in how you deliver your services, but also how you mentor other nurses?
Oh, it's extremely important. You know, for example, you can have a patient, you can have a elderly Black lady, 60, 70 years old, and having a nurse that is also Black, you may go and see the patient, patting their head, ooh, we know as Black nurses, okay, well, her head is probably itching. Maybe we need to see, if we need to wash her hair, we need to, do something specific with her hair. But if you have a Caucasian nurse or an Asian nurse go in and see the nurse patting your head and they're kind of like, oh, what are you okay? Like what's going on? So it's important because you can understand what the patient is going through. It's also extremely important because again, historically, Black people don't trust, Caucasian doctors. They think that they're, either undertreating them or mistreating them. So when you have someone that looks like you, a nurse, a provider, NP or a physician, they feel more comfortable. And these are not my words. These are words that I've gotten from patients before, especially when I was bedside. I can go in. Hey, Miss Jones, I'm Tequila. I'm going to be helping take care of you today. I'm the nurse, that's assigned to you. Oh, honey, I'm so glad to see you. Where have you been? I haven't seen a Black nurse the whole time I've been here. They just get excited, and they're the ones in the hospital that's sick. So it's extremely important because I think Black patients feel like they can relate to Black providers, nurses, and whatnot, just to see somebody that looks like them feel like they're safe and that they're going to be taken care of appropriately.
That's so powerful. I mean, it's really important. We talk about this on this podcast a lot, especially we talk to providers across the country. It's the three T's when it comes to kind of building trust with patients. Just, you talked about it, being transparent about, your background, your experience, your living experience with the patients, right? Giving your testimony, the second T, understanding what your journey has been, delivering healthcare, but also explaining that to the patient. And then finally, you can get to that last T, which is trust. And those three T's are really so important, right? Because as we all know, patients, they can be more open and honest and having a more open conversations, you can get to the core of what's bothering them and really help them. And a lot of times, and like you said, historically, sometimes individuals, Black women specifically, have not been listened to, right? In certain healthcare environments. When you have someone like Serena Williams, who talked about that at a high level when she was going through pregnancy. She felt like she wasn't heard. If she can get heard and she's a celebrity, then and at that level, then patients are not getting heard across the spectrum. And so having individuals, Black nurses specifically, having conversations with patients that look like them, I think that trust level goes a lot higher, and then we can get more to the core, because really it's ultimately about helping patients, right? And I think that's what we want to see more of. So I love that background experience. That so when you kind of talk to mentor nurses across the country, we know that burnout, right, for nurses at the bedside is an all-time high, with over 30% of nurses considering leaving the profession. And this is obviously COVID was a big accelerator of that. What initiatives or support systems do you believe can help Black nurses navigate workplace challenges and maintain their well-being?
Another great question. I think one thing I like to incorporate, when I'm in leadership positions is state interviews. If someone leaves an organization or quit, HR or the leader of the department wants to do an exit interview. But what about a state interview? And so I think that's important because, especially for Black nurses, let's have a discussion about your time here, any, challenges you're facing, because you want to retain your staff. You've invested for them to be there. You want to retain them. So just having those conversations, again, a state interview to see what's going on, how, what's going well, what's not going well. Is there anything that you want to talk to me about that you're experiencing that you don't feel like sharing, outside of the room or, with HR? Something that I can help you with. So I think that's one initiative that's important. And I also think it's very important for organizations in general to have cultural competencies, to address like anti-racism, making sure it's zero tolerance, anti-racism, cultural competent, you know, even if it's a workshop. And then also, I'm not sure if you're familiar like with EAP programs that provide therapists and stuff. It's employee assistant program. Most organizations have it. However, not all organizations make sure that that EAP program is diverse. If something traumatic happens on the unit, or if an employee is going through something, we usually refer them to the EAP program because those resources are there to be utilized. You can get like therapists, all kind of wellness programs, things like that. But when you are sending, especially a Black nurse, to these programs, is your program diverse? So it's making sure that the resources that you're providing, there's some diversity in it because they may be going through something that a Caucasian or an Asian person may not understand. But if you have some diversity there, I feel like that's another initiative that would be very beneficial in making sure that the education, the resources, the things that are provided are actually diverse enough to even benefit the Black nurse because some people don't, just example therapists. Black people want Black therapists. So if you send me to an EAP program and I don't see not a Black or a brown person, okay, thank you for providing it, but I don't want this. So just making sure there's diversity in those resources as well is another good initiative.
Yeah, I love that when you said state interviews, if I remember you correctly. So basically, it's just kind of gathering how they're feeling and what's going on, and getting a sense of baselines in the organization. You can kind of pinpoint any areas that can improve the nurse's work environment. Is that kind of how you look at state interviews? Kind of give me an example of kind of the questions that are asked during state interviews.
Yes, we go to work. But a lot of people, even though they say, oh, don't bring your work life home, people are going through things at home that overflows into work. And so, for instance, a state interview, and it's kind of very informal. Hey Theo, how's it going today? I'll go. Do you have a minute to talk? Sure. Okay. I say, all right. I usually just say maybe 5, 10 minutes. We'll let the charge nurse know, or I'll let them know I'm pulling you off the floor to watch your patient. And hey Theo, what's going on? And most people think, oh, what did I do? Did I do something? What's this about? And it's like, no, I just want to check on you. How are things going? How's your patient load? How's your time management? Is there anything that I can do to help you with, providing patient care? Do you have all the supplies you need, the resources you need? Okay. how's the kids? Because sometimes, I know about the family life and stuff like that because I'm just that open and talkative with the staff. And so it just goes from there, just asking basic questions. Do you have everything that you need to do your job? And sometimes, people may say, oh, well, I feel like we're always short on XYZ. Okay, good. Thank you for telling me. I can follow up on that. Or, they may not have anything, but it's just giving them the time to have the discussion about how are things at work. How are your coworkers? Do you like your team? Are the CNAs, how's the relationship with the CNIs? How's the relationship with the other departments? Because we all work together. And sometimes I get a lot of information. Oh, well, I tried to call report to this floor and the person I talked to was very rude. Okay, who did you report that to? Nobody. I'm like, oh, okay, I need to know that. Do you remember the name? Maybe I need to talk to their leader. So stuff like that, because the slightest thing could make somebody feel uncomfortable and it could interfere with them doing their job. So if they called that person and they felt like they were rude, the next time they call, they may not even want to talk to that person or they may ask somebody else to do it. And that's not what should happen. We all should get along very well because we're all in it for the same reason to take care of the patient. So it's just really a candid conversation. And trust me, I get a lot of information out of that. And when I have the first one, likely the next one, I don't even have to initiate it. People come knock on the door. Tequila, are you busy? Can we talk? Yeah, sure. Come in. What's up? And so it just opens the door for, more dialogue and them trusting me to share whatever issues they have or even sharing, moments of excitement. Like, there was a nurse who I didn't even know his wife was pregnant, but he come in, he showed me all these pictures. He was like, we had the baby. And there, it's just open conversation, open door. Come in and tell me what you got to tell me. And let's see if we can fix it. If we need to celebrate, you want to have a party at work, we can do that. So, state interviews go a long way.
That's so important. I mean, I do that with my team as well. How's your energy, right? And just ask them questions about, yeah, I know you enjoy yoga. I mean, do you have time to do that? Making sure that you're right. It's those outside environments that really influence your day to day work, and you can tell if people's energy levels are changing. And just ask them questions about their outside work environment, not to be nosy, but to your point, just to making sure that they have given space do the best work possible. And sometimes, that outside work influences can change that a little bit. And so by asking simple questions, that's not only do you care, but you realize that they're a person and they're a whole person, right? And you want to bring their authentic self to work. And the way you do that is by showing up for work and making sure you have other things that are taken care of that give you energy to keep your energy high. So I love that. I definitely will implement that in our environment. So thank you for that. When you kind of think, just pivoting a little bit, I would love to kind of get into the journey you got into with social media. A lot of the providers and doctors I talk to, they're independent doctors, they're just trying to run their practices, build up their businesses. They just don't see the need and the time to kind of build up a social media presence. So maybe kind of talk about your journey of getting into social media and especially building a great online presence with Black Nurses Week. So talk a little bit about that and how you got started.
Well, I think that social media is, I mean, that's what it's designed for, to be social. I mean, I'm from Marshall, Texas. The population is less than 30,000, less than 30,000. And so I know that if I want to reach more people, they're not coming to Marshall. I mean, I was born and raised there. I really don't even like being there. So, that's why I travel nurse. But to use social media, you use it to reach more people. There's millions and millions of people on social media, and they're not just, in California, in Texas. They're all over. I communicate with people out of Canada, out of Africa, Black nurses. I would not be able to do that without social media. And so even on social media, I know, people like, oh, you need to niche down to this and niche down to that. Well, ultimately, my thing is Black nurses. So I have a variety of content that I post. It's things that are interesting to me. So I feel if it's interesting to me as a Black nurse, it will be interesting to a few other Black nurses that will then share it with other Black nurses and so on and so forth. I just think it's just another avenue to connect with. other Black nurses and other, I guess I should say other people as well, because not all of the followers are Black nurses. Not all of the people who email me or part of the email list, they're not all Black nurses. There's some that are, Caucasian, there's Hispanics, there's Asians. So, a lot of us have a lot of things in common. And I think social media is just a really great avenue if utilized appropriately to reach the masses. So that's why I use social media and, just try to keep it interesting, you know, informative, um, and helpful, educational in most cases. So yeah.
If you were giving advice to your younger self or other nurses who are contemplating getting on social media to share their authentic self, and what advice would you give them to kind of go over that barriers? A lot of providers I talk to are concerned about, not saying the wrong thing, or, hesitant to kind of, they think of it as, oh, this is a second job. I got to post something all the time. Kind of give some practical steps on how to begin and start on this journey like you've had.
Let's go with the first one. People that want to get on social media and worried about what others may say, I live by what other people think of me is none of my business.
Mm.
You can think whatever you want. People are always going to have an opinion. And I can tell you, people on social media are more opinionated than people in person, because a lot of people will say things that they definitely will not say to your face.
Hmm.
So be it. That's on them. I think that when you're posting on social media, it's content that you feel like, or you should feel like, is, whether you want it to be informative, humorous, whatever it is what you think that your audience wants. And there's going to be some people who come across who have nothing better to do that may say something negative. You know what? You can skip right over them and, focus on the people who are, positively interacting with your platform or whatever information you're putting out there. Posting all the time. When people say consistent, a lot of people think consistency is every day, every other day. No, consistency is if you post once a month and you're consistently posting once a month. If you post every 3 months, you're consistent at posting every 3 months. You do not have to be on social media all the time. At least that's my opinion, because I am definitely not on social media all the time. And the great thing about social media is that you can schedule posts. Sometimes when posts come out on Black Nurses Week page, especially Instagram, because that's the one we're most active on, I did not post that right then. I have prepared that post and I have scheduled it to go out at a certain time. Um, I think some people put so much effort into thinking that they have to be on social media all the time, to the point that they become, stagnant. Like, oh, I don't know what to post. Oh, I don't know when to post. So I'm just not going to post anything. No, there are people that post some of the craziest stuff on social media, and the interaction is crazy. I'm like, I can't believe they posted this. But guess what? It's content. Anything is content. Whether it's a picture, whether it's nothing, a smiley face is something just to capture the people that are there. So I think, you don't have to put all of your energy into social media and have to be on there every single day or every, week or whatever. Do what you can do. Do what you can do your best, and go from there. Don't worry about what other people think, because it's not your business anyway. That's all.
I like that. I like that. Taking that practical. You're right. And I think, understanding that, having intentionality or why you're putting the content out there, especially as a healthcare provider. I mean, a lot of the providers we talk to, this emerged out of COVID, right? There was a lot of disinformation out there, and then having true experts, not healthcare influencers out there communicating something that's evidence based, is so important. And so having, your word, your message out there. We talked to a doctor, cardiologist out of Nashville, and he talked about Dr. Isan. He talked about, he just tired of answering the same questions over and over again, and so he started to put it on social media, and so that was so important. Or Nurse Alice, her importance was just sharing, in her community. To your point about awareness and what's important, so focus on the intentionality of helping people, And then, like you said, what they say is not your concern, right? Just focus on the input. Don't worry about the output. And like you said, be consistent. The consistency could be once a month, could be once a week, could be once an hour, but whatever works for you, and just stay committed to it. And so I love that background and thinking through that. Wow, Nurse Tequila, this has been so wonderful. Just talking about your experience and just putting yourself out there boldly in a time where, you know, uh, being different and saying that you're, focused on a certain population is sometimes being pushed back. But I love that you're being authentically yourself and putting yourself out there. Where can people find out more about you and more specifically, Black Nurses Week?
So people can find out more about Black Nurses Week at www.blacknursesweek.com. We have a website. We're on social media, Instagram, where we are the most and most active. We also have a TikTok, but TikTok is a very different community than like Instagram. We're on LinkedIn, which is also a different audience. So LinkedIn, Instagram. We're also on Threads, and TikTok. And our website is where anyone can find us with Black Nurses Week, our community, and things that we have going on.
Awesome. Awesome. Well, Nurse Tequila, thank you again for your time, everyone. I hope you enjoyed this conversation and learned more about how you can stand out and be your authentic self, but also, looking how you can bring some of your intentionality to what you want into social media and really understanding the importance of that. So, as we all struggle with the new normal of healthcare, hope you enjoyed the podcast today. And thank you again, Nurse Tequila.
Thank you for having me. I appreciate it.
Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.